Hey, nowadays people tend to lose weight for an appealing outlook. But they should rather consider fighting obesity as their moral obligation, as it is the mother of all diseases. Let's dig deep into the parent causes of increase in the body weight. This phenomenon is primarily determined by the following three factors: genetic predisposition, epigenetic modifications, and environmental factors. Since the inception of mankind, we have come across this query that if two people of different build, but of same age, same gender, eat the same amount of food, for the same amount of time, then why is one chubby and the other lean? Let's put in the parent causes and other research-based evidence in this equation to get out an appropriate answer to that question and start to work on our weight reduction in a more efficient and rewarding manner. Our genetics governs the whole makeup of our body by shaping pro-obesity hormonal setup in the body, lowering the basal metabolic rate, and recurrent epigenetic changes can be genetically inherited as well. Epigenetic modifications occur due to some endocrine disrupting molecules, maternal obesity or pro-obesity lifestyle during pregnancy. Fatty and imbalanced diet, overeating, intake of obesogens and sedentary lifestyle are the environmental contributors. Furthermore, there are certain antidepressants and some medical disorders like hypothyroidism and Cushing syndrome associated with obesity. Our body burns the calories in three ways. Our resting metabolism burns most of the calories, hence if we have a lower BMR, it can lead to less calories burnt. But it can be modified and reset to a certain amount by reducing weight and some other mechanisms. Some calories are burnt during the food breakdown. To your surprise, by exercising and increasing the physical activity, you can burn only 10% of your calories. So, exercising alone without a proper dietary restriction will not help in decreasing weight. The notorious compounds to be the cause of obesity are the following: BPA, phthalates and bisphenols, which are present in the plastic bottles, PVC pipes and the food containers. They cause weight gain by inhibited sirtuins and some other mechanisms. Some antidepressants and antipsychotic drugs can also cause weight gain. Let's discuss the role of leptins and sirtuins in increased weight. Leptins regulate the balance between calorie intake and expenditure. When we start starving, fat cells are actually decreased, which in turn increase the level of leptins, which stimulates our hunger center in the brain, which leads to increased appetite and cravings. So, decreased level of leptins make it difficult to lose weight initially. It causes decreased immunity and irregular vessel formation. Endocrine disrupting molecules and obesogens epigenetically block sirtuins, which causes decreases fat breakdown and heart diseases. Obesity is dangerous because it is associated strongly with the following diseases: insulin resistance, thus type 2 diabetes mellitus, hypertension, dyslipidemia that eventually causes cardiovascular diseases, mood disorders, reproductive disorders, fatty liver and non-alcoholic steatohepatitis. To start with the journey of dealing with obesity, you must know that 70% of your weight loss can be just achieved by optimizing your nutrition. Eat low-fat diet. Fat proportion should be less than 10% of your daily intake, while protein intake should be up to 40%. Intake of fibers should be increased and carbs should be minimized as much as possible because it helps you stay in caloric deficit. Moreover, vitamin C, grapeseed extract, resveratrol or vitamin E and omega-3 fatty acids regularize the BMR and regulate the leptins and sirtuins levels. Regular exercise plays less role in weight loss, but it optimizes the cardiovascular health. Increased hydration should be ensured. Techniques like intermittent fasting are also helpful. GLP-1 agonists like tirzepatide are introduced to be helpful in people with BMI greater than 35 and above 40. Bariatric surgery is the choice. This is the golden pyramid of fat loss. This will help you discover more about fat loss. Keep yourself and people around you healthy and eradicate obesity and hundreds of diseases associated with it. If you like my videos, do subscribe and stay in touch with the animacious world.